Have you looked in your medicine cabinet lately? Or maybe it's your kitchen cabinet or even a drawer and it's just full of supplement bottles. Maybe it's something your friends swore by and told you that was the thing you needed to have to get help. Or maybe you heard about it on social media or your doctor recommended it or some influencer said it was a must have. And before you know it, you have now spent hundreds of dollars on supplements and you're left wondering, do I really need all of this? Today, we're going to look at the supplements that I recommend most often for women in midlife, why I recommend them, and who may actually benefit from them. And stick around for the last one because this is one that really surprised me too, but is great for women in midlife. So, the first thing I recommend is protein. And protein isn't really necessarily a pill. You're going to go out and purchase it. There are protein powders that you can use, and we'll get into that in just a minute. But why is protein so important? Because as our estrogen declines, it contributes to a loss of muscle mass. So, getting the protein that helps preserve our muscle mass, especially when we're adding in strength training, we want to keep that muscle strength for balance and just staying independent as we age. It's also going to support your metabolism, which we know is really important to us at this age. Now, it's recommended to get 25 to 30 grams of protein each meal, up to around 100 grams overall through your day. So, it's most important to make sure, number one, you're getting some protein on your plate. But for those who don't like to do the counting, I'll understand that I'm not always one that wants to be focusing on counting. So, let's talk about a couple different ways to make sure you're getting that. So, one of the easiest methods for figuring out protein, especially if it's meat, with your meal, just look at your amount you have, and you want to have about the size of the palm of your hand, a deck of cards, just depending on the size of your hands, too. Another easy way to do that is just making sure you're putting protein on your plate first and eating your protein 3 times a day. So rather than grabbing toast and coffee and fruit for breakfast, making sure you're finding those ways to get that protein there. Now, food first is always my choice, but supplements are there and they're called supplements for a reason because they're used to fill in those gaps, but not to replace a healthy diet. So, if you're struggling to come up with enough protein from your food, you can use the protein powder to fill in the gaps. Protein powders can be used in a quick breakfast, throw it into your smoothie, add it into yogurt or your oatmeal. You can make an afternoon snack out of it. So, just finding those ways to just fill in what you're not getting with your meals. So, my next recommendation is vitamin D. So, as our estrogen is declining, it affects how we absorb calcium. And then we're trying to protect our bone density. Vitamin D is really important in the absorption of calcium. So, that's one that you may want to consider looking into. We're already dealing with a lot of mood and depression issues during this time. And we've talked about how it can be linked to the gut, but it can also be linked back to vitamin D deficiency. So it'd be a good idea to have some blood levels drawn and see where your vitamin D is. And if needed, you can do some supplementation. And when it comes to foods first, with vitamin D, unfortunately, there's not very many foods that are actually containing vitamin D sufficiently. So, the best way to get it is getting sun exposure. Unfortunately, that time of day is the time they tell us to not be out in the sun, and then, of course, you're wearing sunscreen, and you need to have a certain amount of time exposure, skin exposure, in order to make enough vitamin D. And if you're fortunate to live in these northern climate zones, you don't always get to get sun at all in certain times of year. So that may be a good another reason to be supplementing with the vitamin D. The vitamin D3 is your most effective at raising and maintaining your blood levels. Getting some K2 in there can be helpful if needed. Vitamin D is a fat soluble vitamin, so it's absorbed best with a meal that is going to have some fat so that you can absorb it much more efficiently. Now, many multivitamins have vitamin D, but it's on the lower end of what may actually be helpful for us. The next important one is omega 3 fatty acids. So, as estrogen, which is important for everything here, right, is declining, it has an anti inflammatory effect on us. And so now we're losing that. So we start to get more inflammation, and we have spent years of unhealthy lifestyle, eating the wrong foods. And so there's always a chronic inflammation going on. Now it's going to get out of control. It can affect certain medical conditions, it can affect your joints, and you just don't feel like you're bouncing back as easy. So, those omega 3s are a great way to get in there and help with that anti inflammatory effect. Your brain is nearly 60% fat. So, when you're not getting enough omega 3s, you feel a little more flat, foggy. We get that brain fog feeling. And we just say that's just part of aging. Getting those omega 3 fatty acids in there are important. And the omega 3s have protective qualities on your cardiovascular system and protecting your heart. So, as those are declining, you're going to have less of that protection. Omega 3 fatty acids are not produced in our body, so it's important to get it in other ways. So, fatty fish, nuts, seeds, avocados are good ways to add those in. If you aren't able to get enough of those through your foods, then you can add in some of those supplementations. Now, if you're on a blood thinner or you have surgery upcoming and you're doing higher doses of omega 3s, it does affect clotting. So it's always worth checking with your doctor if you're on any sort of a medication, if that's an okay one to be taking. The next is magnesium. Magnesium does so many things for us. First of all, it helps with regulating our nervous system. And when we have that wired but tired feeling, it helps with that sleep quality. So you're not doing those 3 a.m. wake ups and not being able to get back to sleep. Along with calcium, vitamin D, it helps with our bone health. It helps with muscle cramps and restless legs. So there's so many things that magnesium is needed for. Stress depletes our magnesium. Midlife, we've gone through all the stress, and now as estrogen is declining, what we used to be able to deal with earlier is now not as we're not as able to deal with. So getting the magnesium in there. The one I recommend most is magnesium glycinate. It's one of the best absorbed forms. It's the gentlest form, and it really will help with sleep and anxiety. And here's the one that's going to surprise you: creatine. It surprised me. It's so important for women in midlife. And to me, creatine was always what my boys used when they went weightlifting or were in sports. So, why creatine? Well, we know we've talked about that we start losing muscle mass here in midlife. So, we want to start doing more strength training so that creatine is going to help support those muscles, keeping them lean and strong. Along with the calcium, the vitamin D, the magnesium, creatine can also help with bone density. So, getting there and doing strength training, which is going to help support that. And here is the thing that surprised me most about creatine is it supports mental clarity and it helps reduce that mentally drained feeling that we're experiencing in midlife. And remember, supplements are exactly that. They're supplements. They're meant to fill in the gaps, but not to replace a strong foundation of good nutrition and healthy habits. So, when you're trying to feel better, it's easy to believe that every supplement is the one that you've been missing. You don't need everything that's being recommended. Start with the supplements that have the strongest evidence and make the most sense for you and your symptoms. And remember, supplements can interact with medications, so they may or may not even be appropriate for you to be taking. So it's a good idea to talk with your healthcare provider before adding any new supplements into your routine. Now, you still have that cabinet or that drawer that's full of supplements, and we've only talked about a few of them today. So, what about the rest? In the next video, we'll take a closer look at those bottles and talk about when they may actually be beneficial and when they're not necessary. If you're feeling overwhelmed and wondering where to even start, let's just sit down together. We'll look at the whole picture and create a plan that makes sense for you and your body and your symptoms and your goals. Because you get to do midlife your way. And if you'd like to work through this together, you can schedule a time with me using the link in the description below. We'll see you in the next video.